My name is Dr. Peter Vila. I'm a facial plastic surgeon in Portland, Oregon, and my practice is Portland Face Doctor. And I want to talk a little bit about the piezo, and specifically the W&H unit, as far as how that helps me in my practice, and specifically with my rhinoplasty practice. I've been using the W&H Amadeo and piezo for just over a year now, and it is definitely a game changer for me in terms of the outcomes for my patients and the ease with which I'm able to make bony changes for rhinoplasty. And so the tips, there are a ton of different tips that you can use. The company has been fantastic about letting me try out different kinds of tips. I do both open surgery and closed surgery, so I need different tips when I'm doing different procedures. And so it's really nice to have the variability to be able to do that. They have a wide variety of tips available, and I use lots of them during the case depending on what I'm doing. Sometimes I also use them for bony septal deflections and things like that. Overall, the big advantage of using the piezo is that my patients don't get any bruising after surgery. Now, depending on whether I'm doing an open surgery or a closed surgery, obviously there's some swelling involved. If I'm doing something open, they are going to have a fair amount of swelling that's expected just because I am dissecting more and creating more swelling afterwards. But that resolves fairly quickly and pretty much what you would see with the standard rhinoplasty approach. So it's really been impressive for me. The company has been incredibly responsive. Whenever we need supplies, I reach out. They're quick to deliver it. I've never had a problem with the machine. It works really, really well. And so it's really been, very impactful for the practice. One of the really fun things about the W&H unit is that you can actually switch between the piezo and the drill, and it's very easy to do. So there's irrigation tubing that goes to the scrub tech, and my scrub tech is able to switch it fairly easily and quickly from the drill to the piezo. There are two different hand pieces, and then it's just a switch on the foot switch, and the machine goes, and you're ready to keep going. You don't need to stop, you don't need to switch anything out, there's no equipment change. It is very fast. Really, really nice, especially for open rhinoplasties, to have the drill available. If you're making bony changes where you're doing surface modification, or you just need to, for a really bad, bony issue, the drill is nice to have. And so you can switch back and forth fairly quickly between the piezo and the drill. And I would say that's a big differentiator for W&H. As far as the user interface on the machine, it is really helpful to have something that's simple and easy to use. And the W&H unit is really great at that, because basically, even if you've never used this unit before, your scrub tech, your circulating nurse will be able to figure it out fairly easily. The tubing is fairly easy to set up, and then the machine, the interface on the actual device is very easy to use. Can all be controlled through the foot switch, so you don't actually have to take your eyes off the patient. And if the circulating nurse is helping you out, it's easy for her or him to figure out as well.